Health officials in Cameron County say that just because no new Zika cases have been reported, that doesn't mean the Zika is going under the radar. CBS 4's Michelle Vargas is here with how the county is trying to tackle Zika.
Marcy, a disease specialist assigned by the federal government to Cameron County, joins the fight against Zika. She will be at the forefront of the issue, focusing her time solely on Zika cases and prevention.
Before we identify this person as a local case, we look at all the factors involved: contact, social history, and where they've been in the travel.
Around this time last year, there were no reported Zika cases in Cameron County, but right now 4 cases of the virus have been reported and 5 more people are under investigation.
This is the battle that we deal with along the border all the time. How do we go about containing this when people travel? Everyday way of life.
To help get a grip on the workload pertaining to Zika in the county, the CDC assigned a disease specialist, better known as an epidemiologist, to focus solely on Zika cases.
Zika alone was keeping the staff busy, but we had to worry about the continuing operations. What happens to all the other diseases that are reported? There's over 85 conditions that have to be reported to our department. And so Zika was taking over a lot of the workload.
Brownsville resident Ariana Garza was chosen to fill the position. Guajardo says getting her was crucial for the department.
She understands that time is of the essence here. We know we get a positive case for Zika, we have to start getting that information ready to go to contact individuals and making sure that it's going to be something that's going to help us to contain the spread of the disease.
Out of the Zika cases reported in Cameron, Guajardo says 90% of the people traveled to Mexico.
A lot of people will tell us, they've been to Matamoros, they've been to Reynosa, they've been across the border every other day. It's very difficult to pinpoint exactly when they could have been infected.
Obviously, even though it's just a couple of blocks away, crossing the bridge, the reality is it's a separate country and they do things differently. This is probably one good or bad example, depending on your perspective, where we should be working hand in hand in order to better inform both sides of the river of the threat and the danger of the Zika virus and the Zika mosquito. But no, it's not surprising that these are travel-related cases.
Garza will be working with Cameron County Health Department for a year. In the studio, Michelle Vargas, CBS 4 News and ValleyCentral.com.